आप मुझे गुड आफ्टरनून मैम।
गुड आफ्टरनून, कैसे हैं?
मैं ठीक हूँ। आपका लंच हो गया?
बाद में करूंगी, आराम से।
अच्छा, ओके।
आप कर रहे हो?
हाँ नहीं, आई मीन एक्चुअली क्या हुआ ना, हमारे यहाँ बच्चे सब्जी खाने में बड़ा तंग करते हैं। तो मैंने उनको वो जो सब्जी बनाई हुई थी उसके साथ में रोटी में भर भूर के वो पिज्जा बना के दे दिया, तो वो खा लेते हैं।
दैट्स सो कूल। आप वैसे भी बड़े अच्छे कुक हो।
हाँ, कुक तो मैं हूँ, मुझे काफी लोग मेरा माय सन इज विद मी। चल अभी के लिए वीडियो ऑन करती हूँ मैं अपन
बिल्कुल
लाइव।
बिल्कुल।
वो मेरी बेटी जैसे ही मैंने बोला वीडियो ऑन करते तो भाग गई।
अनुषी भाग गई?
आरुषि भाग गई, बिल्कुल।
स्कूल है यही भी ऋषि की। हाय बेटा, कैसे हो?
नमस्ते।
नमस्ते बच्चा।
ये केशव है मेरा सन। आयु कम।
हाय हाय केशव।
And
केशव ने
she
क्या खाया आज? हाय अरुषि। अरुषि की मैंने ड्राइंग्स बहुत देखी हैं।
गुड
अरुषि
आफ्टरनून।
गुड आफ्टरनून। बहुत ड्राइंग्स देखी हैं आपकी, मम्मा मुझे शेयर करती है। मेरी डॉटर का नाम भी अरुषि है, पता है आपको?
अभी इसने पता है, आज भी एक वुमेन्स डे पे ड्राइंग बना दिया है, अभी मैं थोड़ी देर में शेयर करूंगी।
बिल्कुल बिल्कुल। और मैं कलेक्शन रख रही हूँ आपकी ड्राइंग्स की, पता है?
मैंने
They're
इसका
really
एक
nice.
केक डेवलप कर रखा है, प्रिंसेस आयुष आर्ट करके।
वाह वाह, सही है।
हाँ तो
बहुत प्रिटी हो यार आप तो। मम्मा से भी प्रिटी हो, पता है? मम्मा से प्रिटी हो। मम्मा तो प्रिटी है ही है। ओके बच्चा, बाय। सर ने ज्वाइन कर लिया है। आप सर से मिल लीजिए, सर ने ज्वाइन कर लिया। आप सर को तो वीडियो दिखाइए। गुड आफ्टरनून सर। सर अपना अनम्यूट कीजिए सर। अनिल सर अनम्यूट कीजिए प्लीज अपने को।
जी जी।
हेलो, गुड आफ्टरनून सर। गुड आफ्टरनून।
डॉक्टर निकिता। गुड आफ्टरनून डॉक्टर सबिता।
गुड आफ्टरनून
थैंक यू फॉर ज्वाइनिंग सर।
थैंक यू सर, आपने इतने मुश्किल टाइम में भी अपना टाइम निकाला सर। इट्स रियली ग्रेट।
All pleasure. In fact, we have been looking forward to it. That's why we just decided that we'll carry on with this work today.
Yes sir, yes sir.
मैम, यू एंड सर आर लाइव, मतलब आप दोनों लाइव रहेंगे।
जी,
और
जी.
मैं हाँ, बाकी मैं कहीं पे भी नहीं रहूंगी। आप मेरा नाम कोट भी ना करें प्लीज।
बट न्यूज़ तो आपने ऑन करना है ना?
हाँ हाँ, वो मैं कर दूंगी। यदि आप वो चाहें तो मैंने आपको व्हाट्सएप भी कर दिया।
नहीं, वो आप ही करिए। अच्छा अनिल सर ये ऐसा है कि ये फेसबुक पे भी जा रहा है और यूट्यूब पे भी जाएगा, तो अगर कोई हमको ज्वाइन नहीं भी करेगा तो भी चलेगा। बट हमने जूम लिंक भेजा है लोगों को, अगर ज्वाइन करेंगे, अगर कोई क्वेश्चंस हो गए विल आस्क देम, अगर वो चैट बॉक्स में डालेंगे। ठीक है सर?
हमारा ना मैक्सिमम रिसर्च पे इवेंट्स होता रहता है, लेकिन ये हमने कॉमन पीपल्स के लिए, मतलब कॉमन जेंट्री के लिए ये स्टार्ट किया है, मेडिको जर्नलिज्म। लास्ट हमारा ऑन्कोलॉजी डे पे था, अभी कैंसर डे पे लास्ट जो, और अपना ये जर्नलिज्म मेडिको जर्नलिज्म का था। तो इसमें है ना, हम लोगों ने मतलब कोशिश करते हैं हम सबको ही लिंक दे पाए, वो लाइव लिंक फेसबुक की। तो हम यहाँ जूम की शेयर ही नहीं करते, तो इसलिए
इस बार हमने शेयर किया है। इस बार
हमने किया है। तो वी आर नॉट एक्सपेक्टिंग मच पार्टिसिपेंट हियर, बट हाँ, आई एम श्योर अबाउट कि अपने को कम से कम 2,500 से 3,000 व्यूवर्स देखेंगे रिमोटली, मतलब फेसबुक पे, यूट्यूब पे। ठीक है सर?
ओके मैम, ओके।
और सर ये फेसबुक पे रहेगा हमेशा के लिए और यूट्यूब पे रहेगा।
ओके फाइन।
और सर निकिता मैम जो है ना, मतलब
जी,
शी एंड हर हस्बैंड डॉक्टर राकेश पंडित, दे आर मैनेजिंग द शो। आप इनसे मिलेंगे ना,
ओके।
दे आर रियली वर्किंग, मतलब नॉन प्रॉफिट वे से। अपना कमाई तो करनी है, वो तो करनी, बट रियली वेरी गुड।
So kind of you, ma'am. Thank you.
That's very nice.
सर को मैम, सर को एडिटोरियल बोर्ड में डालिएगा, गायनी के जर्नल में, है ना सर?
हाँ हाँ, हमारा
Okay.
जनरल है इंडियन जर्नल ऑफ ओबेस्ट्रिक गायनेकोलॉजी रिसर्च। मैं डेफिनेटली आपका मैम, मैं सारी डिटेल्स सर को आपको कॉपी करते हुए शेयर कर दूंगी एडिटोरियल ऑफिस में। डेफिनेटली इट्स ऑनर टू हैव हिम एट
Thank you so much.
थैंक यू सर।
अनु पेपर पेन ले लेगी।
सर ठीक है, वो उसने याद कर लिया छुट्टी ने?
No. She is shying away. She ran away.
So नहीं रहा फिर हमारा, है ना? निकिता मैम को शेयर किया।
In fact, my idea was that उसको थोड़ा सा share किया and we will, with the reference of her kind of health and health of girls like her, we as a nation are bothered. We as doctors are bothered.
Nikita ma'am, Arushi can do that. Hello, Nikita ma'am. Hello.
Arushi can do anything. Actually, she is very good in this. Even अभी वो भी पैनलिस्ट की तरह इनवाइट हुई एक इंटरनेशनल इवेंट में।
हाँ, तो Arushi can speak something about Women's Day and sir can talk to her. Sir, ऐसा कर सकते हैं?
Yeah, we can.
Arushi,
आप बोल के थोड़ा सा बोलो।
उससे पूछ लेती हूँ।
पूछ लीजिए।
हाँ, तुम थोड़ी कम।
सर, मैम की डॉटर है Arushi and she's at her home presently. अभी ऑफिस से नहीं कर रहे, घर से कर रहे।
तो हम उसको अब मतलब what she have to tell, actually थोड़ा सा गाइड कर दे तो ढूंढ लेगी वो कुछ।
No, she just has to wish the Women Health Day to all the women who are around and watching this program, and say something about why women health is important, and then we can carry on.
Do you able to do that? Abhi within 5 minutes.
She has just to say 3 or 4 lines.
She can say happy. Sir, you can tell her to say certain lines. You can tell her.
Yes, no, from the perspective of a young girl who has to live whole of her life, and what does she actually want? What is in her mind that the medical fraternity should do for girls of her age and the years ahead for them.
Arushi, are you willing?
Are you willing to do that?
It's not forced, बेटा. अगर चाहते हो तो करो.
तो आपके पास में अभी 10 minutes है. So you just write 4-5 lines. Yeah, your dress is okay, no issues.
She's looking good. She's looking good. I saw her. She's looking pretty. That hairband and all. She's looking good.
Oh yes. So okay, she will try. Okay.
Okay.
I'm updating you within 5 minutes.
Nikita ma'am, जब video on, जब newsreel के बाद, she will say newsreel के बाद, you can tell that Arushi is going to say something, है ना?
Okay.
Arushi is going to wish, है ना? आप ये बोल सकते हो, then you can show Arushi. Arushi is going to wish. या मैं बोलूं?
I'm not into show actually.
नहीं, okay. I'll say that a small girl, Arushi, is going to say something on Women's Day, and you can then you can show her. Let her say, and then we'll start with the interview.
Okay. Great idea.
Will do. All the best, Arushi. All the best. सर, मेरी डॉटर का नाम भी अरुषि है ना सर?
अच्छा.
सर, आपके बच्चों का नाम भी ए से शुरू होता है ना?
हाँ, आदित्य एंड अभिजय.
हाँ, वही ना. मेरे बच्चों का नाम भी ए से, अरुण से ही शायद शुरू होते हैं. अखिल एंड अरुषि.
बेलू वाज ऑफ द ओपिनियन दैट ए से ये एग्जाम में बड़ी जल्दी बुला के इंटरव्यू देके देन दे कैन रिलैक्स द होल डे. Otherwise, if names are from later letters, then one has to wait for the whole day for that.
सर, ये तो मैंने सोचा नहीं, लेकिन ये बात मुझे लॉजिक लगी. मैंने ए से अरुण के नाम से अरुषि एंड अखिल भी केप्ट. नेवर थॉट. बट ये तो बड़ा अच्छा है सर आइडिया. मैम बड़ा दिमाग लगाते हैं.
But I don't know whether these things are now possible because
नहीं सर, आजकल जो रोल नंबर्स होते हैं ऑल अल्फाबेटिकली.
अच्छा, अल्फाबेट.
हाँ, हमारे टाइम नहीं होता था. हमारे टाइम लकीली मेरा नाम दे तो एस है पीछे.
बहुत लेट आता होगा.
हाँ सर, अब तब नहीं प्रॉब्लम आती. तब रोल नंबर वाइज नहीं होता था ना आपके और मेरे टाइम. अब होता है सर. अब सारा कुछ रोल अल्फाबेटिकली होता है.
So in your class they had to wait for the topper till the end.
नहीं सर, हमारी क्लास में होता ही नहीं था ना सर।
आपका वाइवा लेट आता था।
नहीं सर, पहले हमारे टाइम में, आपके भी टाइम में कहाँ अल्फाबेटिकली होता था, पहले सारी गर्ल्स थी फिर बॉयज
रोल
थे।
नंबर, आई थिंक रोल नंबर्स वर देयर, है ना?
हाँ रोल नंबर्स थे ना, लेकिन आजकल सर रोल नंबर्स अलॉट ही ऐसे होते हैं स्कूल्स में, मेडिकल कॉलेज में, अल्फाबेटिकली।
पहले आपको याद है, दे वर परफॉर्मेंस बेस्ड, आई मीन आपके रिजल्ट्स कैसे होते थे 12th वगैरह में, तो उसी से कई बार होते हैं।
सर इस बार यूनिवर्सिटी ने क्या किया, जो रोल नंबर्स यूनिवर्सिटी ने अलॉट किए ना फर्स्ट ईयर को, उन्होंने नीट के बेसिस पे अलॉट किए इस बार। इस बार जो हमारा ए बैच था ना, पूरा एलीट का बैच था, बी बैच से थोड़ा कम था, सी बैच बुरा हाल था। तब हमें समझ आई, बच्चों ने बताया कि नीट के स्कोर पे यूनिवर्सिटी ने उनको यूनिवर्सिटी रोल नंबर्स अलॉट किए एग्जाम के टाइम। दैट वाज सरप्राइजिंग सर।
ओके ओके ओके। Dr. Sabita, now we'll be writing that project also for ACME.
ठीक है सर, दैट्स राइट, ऑल द बेस्ट सर। आपका बस खत्म होने वाला है ना सर?
हमारा खत्म होगा, but what do you have to do physically? Go there and visit them for
सर
few
अब तो
days?
फिजिकली होगा ना सर, 3 days, 2 days, हाँ 2 days।
उसमें क्या the project is to be submitted or the only
सर,
paper?
सर पोस्टर बनाना है आपको, पोस्टर बनाना। सर मैं अभी आपको स्पिल कर दूं, क्या करना है? पोस्टर बनाना है, आपके जूनियर्स ने प्रेजेंट करना है, बड़ा आपने जूनियर्स को प्रेजेंट करना है, जूनियर्स ने स्टेज पे प्रेजेंट करना है। ये हम वर्ड हमें कोई बताता नहीं था ना, ऐसा कुछ है।
अच्छा अच्छा, ओके ओके,
इट यू विल एंजॉय इट।
ओके।
हमने तो मिस किया, हमारा ऑनलाइन हुआ ना सर।
अच्छा,
हमारी टाइम कोविड का काफी डिले हो गया था, लेकिन सीनियर्स का हमने किया था, इसलिए हमें पता है।
अच्छा, there are 2 visits I'll be having to Ludhiana. One would be on 25th and 26th for the Yuva Foxy, and the second would be in May. Probably May we joined. 4th May was the induction. In COVID times we had a on the Zoom induction for
online.
So I think we'll be completing our 1 year in May 4th. And then after that,
all depends, because I am the faculty of junior batch. I'm adjunct faculty of your junior batch. आपने देखा होगा उसमें ना, पहले मेंटोर थे आपके टाइम। मुश्किल काम है आपका। अच्छा चल रहा है स्टीम प्रोफेशनलिज्म एंड एथिक्स ना?
प्रोफेशनलिज्म एंड एथिक्स अभी क्रिटिकल अप्रेजल, I mean last the critical appraisal of batches, different batches.
नेक्स्ट बैच का है साइंटिफिक राइटिंग, उसमें मैं हूं ना, तो
अच्छा,
आज जूम मीटिंग है उनकी।
So when do these things end actually? The thread, when does it end? I mean, it goes till the end. I mean, 4.
सर आपका सबमिशन शुरू हो जाएगा ना सर,
अच्छा,
प्रोजेक्ट का।
अच्छा,
आपको टाइम दिया जाएगा ना।
Mom, can Ayushi give an I mean एक
demo?
rehearsal दे दे?
Yeah, sure. I'll introduce Arushi.
Good afternoon.
Good afternoon. We have a little girl named Arushi who's going to say something on this Women's Day. Yes, Arushi, go on please.
भाई ऑफ दिस वीडियो, बिकॉज आपको लाइव रहना है तो वीडियो भी ऑन करना, ठीक?
हाँ Arushi.
एक सेकंड। यस मैम, वो वीडियो उसने ऑफ कर दिया था, स्पॉटलाइट कर दिया।
Before we start, we have a little girl named, sweet girl named Arushi, who's going to say some words on this Women's International Day. Yes, Arushi, please.
I wish a very happy International. I wish a very happy International Women Day to all the women. Every woman succeed to be an inspiration to others. When women are stronger, when they cheer each other on. I wish a healthy, wealthy, and beautiful feminism to all the women.
Very good. It was lovely. You
Very
rehearse
nice,
it
very
1 or
nice.
2 times.
Very nice.
Go slow. It's very good. All the best, Arushi.
Thank you.
सर कुछ और ऐड करना है? एक्चुअली आपने जो हेल्थी बोला था तो मुझे इतना समझ आया, तो हमने
I think what Arushi should do is that after wishing the happy Women's Day and showing her concern about the women well-being, and she should say that I request all the fraternity of doctors to advise how women should lead a healthy life.
Yes. Yeah, you can share. She needs to. I request the panelist You can share that. Sir?
I request the panelists, or you can quote Dr.
Yeah.
Anil sir. Huh? Thank you, Dr.
Panelists is okay. Panelists is
Panelist.
okay.
Okay,
Panelists.
panelists. Okay.
Both the panelists. I request both the panelists.
नहीं sir, both the panelists में sir आप
Panelists, okay, fine.
panelist,
Panelists,
expert panelist you can say,
expert panelists.
expert panelist to guide us about the women's health, है ना sir?
To guide us as to how women can lead a very healthy
Healthy
and productive life.
To guide us how
About
the woman's lead.
Me guide us how the women can lead a productive and healthy life.
guide us
About
the woman.
how the women,
How the women.
women, it's women beta, women can lead healthy and productive life. Okay, healthy and productive life. It's okay, Arushi?
Yeah.
Okay, done.
Healthy and
Done.
productive life.
Okay. I think we are now 2 minutes short.
Ma'am, now we are, I'm making you live within a minute, okay?
Okay. All the best, Arushi.
You too.
Thank you. All the best, sir. Also.
Yeah. It is so nice to have Arushi on the screen.
Yeah.
Arushi is in which standard?
Arushi, आप कौन सी क्लास में है?
Oh, actually muted थी ना.
Mommy.
8th. Wow.
8th.
She's at that particular age.
She must have already decided whether she wants to become a doctor.
You want to become
She
a
does.
doctor? That's
She wants to become a doctor. She is going to be a very good doctor.
yes. And her parents are so expert in this because they are attached to so many doctors and multiple fields.
Yeah.
All the doctors around the globe they know.
Yeah,
Sri Lanka se
45,000. Sir, around 45,000 doctors are associated with us.
Great. That's a great
Sir,
initiative.
it spreads from Malaysia, Singapore, Sri Lanka, London, everywhere. It's all spread. USA, everywhere. हम लोग मिलते रहते हैं ना सर उन पे ऑनलाइन पोर्टल पे.
Yeah.
I think
Yes,
Nikita
sir.
ma'am, we are going live now
Yeah. Yes, madam. Now we are live.
and we are recording it. Okay. आपको Good afternoon all. Today is 8th March, International Women's Day. And on this day, as part of IESRF Insight Medico Journalism, I, Dr. Sabita Yograj, member executive body IESRF and journalist for today, is going to interview one of the topmost gynecologist and obstetrician, Dr. Anil Mehta sir, who is professor and head, Department of Obstetrics and Gynecology, Government Medical College, Kathua, J&K. Sir has many achievements to his credit. If I start them, it will take me a full day to repeat that, but I'll only quote a few. That he is fellow of International College of Surgeons. He is presently the president of Jammu Menopause Society and member of multiple organizations like ISAR, IFS, etc. Now, IESRF, that is Innovative Education and Scientific Research Foundation, is a non-profit, one of the non-profit leading organization which is dedicated to medical and scientific research. And it is also associated with various scientists, medical professionals, research scholars, and students who have dedicated their life totally to research and development in the field of medical sciences. ISRF platform has more than 4,500 researchers spread all over the globe, and it's doing continuously conducting conferences, webinars, and workshops to make young researchers, editors, reviewers, scientists aware about different aspects of research and help them to bring out the best in them. Now, as part of medical journalism, what is medical journalism? Medical journalisms are the topics which is discussed for the common people, and medical journalism topics, as part of this, ISRF Insight have discussed multiple topics related to different medical and health issues to make common people aware about them and how to manage them. So today's topic is everything about women's health. But before that, a sweet little girl, Miss Arushi, wants to say something on this International Women's Day. Yes, Miss Arushi, please.
First of all, I wish a very happy International Day to all the women. Every woman's success should be an inspiration to others. Women are stronger when they cheer on each other. I wish a healthy and wealthy and beautiful feminism to all the women. And now I request the expert panelists to guide about how the women can lead healthy and productive life.
Very nice. Thank you, Arushi. This is
Very nice.
really...
Thank you, Arushi.
This is really a very good question. So, sir, I welcome you to this again, ISRF Society, Insight Medical Journalism, the topic we discussed, and as Arushi says, we should discuss it. So, sir, we have seen that in today's society, there is so much hustle bustle. We are all busy. We don't have time for anything. We're always working. And moreover, the social networking has increased. And our health has taken a backseat. And we are not considering that health is a very important issue. So and especially for the females, because females have to work at home, at the workplace. So they are more burdened. So, sir, can you tell us why the health should be an important issue, especially for females?
Thank you, Dr. Sabita and Dr. Nikita, and I'm thankful to the ISRF for inducting so much of insight into the medical research part. And we have a responsibility. It's not only that by wishing women International Day, the things are over. There is a great responsibility as to what children like Arushi's age, especially the girls, because they are going to be very productive and they are going to be very much responsible for the development of this country, India, and at the same time other countries as well, in larger perspective, whole of the world. And women are going to contribute a lot to it. Now, what do children like Arushi look forward to as far as the medical health system is concerned? What are their, it is our responsibility to keep these little girls healthy. When they are grown up women, they should be healthy. And when they become older also, what are we doing about that? So there has to be a comprehensive plan so that today we will be discussing the women health in a total perspective. It is a responsibility, and to have healthy nations and healthy countries and healthy world, it is very important to empower these women, not only with education, not only with the other things in their armamentarium, but they are to be made strong as far as their health is concerned. So at all ages there are different perspectives. Their healths are to be addressed differently. What I want to say is that we have to not think about the woman health as a whole, but we have to segregate into different segments as to how we address children health, how we address young adolescent health, reproductive health, or a perimenopausal health, or a menopausal health, right? So we can always design a mechanism so that we can make them aware. You're not audible. You're not audible.
So basically, women's health is to be divided into different age groups. So very right, very right. We have to take care. Just to interrupt, Nikita ma'am, can we display that newsreel, please? Nikita ma'am? Nikita ma'am, are you there?
Yes, ma'am, we are displaying.
Yeah. Thank you, Nikita ma'am. Thank you once again. And sir, a very important question I want to ask that नोशन क्या है आजकल कि छोटे बच्चों में, छोटी लड़कियों में गायनी की प्रॉब्लम्स नहीं होती. In childhood we don't have gynecological problems. So is that correct?
Yes, although these little girls were from the age group when they're born to about 10 years, yeah, the gynecological problems are not much, but yeah, you can't say that there are no gynecological problems. They may have problems like, the infections they have congenital gynecological problems of non-development of the organs itself. And then there can be other problems like you see what is happening now is that these little girls with the age of menarche was a period when actually they used to start with their menstrual cycles, but the age of menarche has gone down. And previously we used to have them have menarche at about 10 years or maybe 12 years. But now at 8.5 years, the age of menarche has come down, and at 8.5 years, you can expect them to have menstrual problems. So they can suffer from the altered menstrual presentations in that age. So they can have, and then you can't ignore a few children. They're having ovarian cysts and even ovarian malignancies. And you'll be surprised to know that there are few females when they can develop ovarian tumors even when they are in utero of their mother. I mean, when they are in unborn, at that time also by ultrasonographically, you may be able to diagnose their tumors. So unfortunately, I find it worth mentioning that if these children they have tumors, there are more chances to have malignant tumors in childhood age rather than if they develop these ovarian cysts later on. There are certain congenital abnormalities like the ambiguous genitalia or other problems like non-development of female organs. So those are the important things. Infection is one of the very important components of the childhood girl care. So lots of they have fusion of labia. Many of small little girls, they have fusion of labia, and we have to separate them under anesthesias. And then they may have infections which are to be treated judiciously. And not only that, to mention that these girls who have worm infestation, they may also have infections of the vulvovaginal region.
सर इन्फेक्शंस की आपने बात की कि बच्चों में इन्फेक्शंस हो सकते हैं, छोटी लड़कियों में. सर आप बता सकते हैं ये इन्फेक्शंस के साइन सिम्टम्स क्या होंगे? लाइक हाउ कैन मदर्स डिटेक्ट दैट द चाइल्ड इज सफरिंग? कैन यू टेल अस अबाउट दैट?
Mothers usually they bring these children to the doctor with chief complaints of itching, incessant itching these girls can have, and there may be a redness in the vulval region which they notice, and they may actually notice some kind of purulent discharge also. So very common. I mean, we almost see 1 to 2 patients in a month, small little girls with.
So it means कि जब बच्चे को itching हो, खारिश हो रही है या कोई discharge हो रहा है, mother should take care. It should not be taken very lightly. उनको seriously इसको लेना चाहिए, and they should take her to the doctor. That's very good, sir.
Yes, now you are having more aware mothers. They are more educated, they're more aware, and they are more concerned about their children. And they do the strata may be any, even the low socioeconomic status girl ladies who are more educated than the past. So they immediately bring these little girls to the doctor, and they ask for the medical services.
You said that there can be like ovarian tumors even in the young age. Sir, what are the symptoms and signs in young girls about these?
See, usually these are indirect findings only. It is majority of the times we come to know about these only after we investigate through ultrasonography or other. But the pain, the pain part, they may complain of pain in the lower abdomen. Maybe if the tumors are large, they may notice a enlargement in one of the quadrants of the abdomen, and then they contact doctors. But usually it is a incidental finding on the ultrasonographic examination.
सर आपने कहा पेन, तो इसका मतलब कोई भी अगर पेन है बच्ची को, तो it should be not be taken lightly, it should be taken seriously.
Yes, this is what usually parents do. They take these little girls to pediatricians, and while examining, completely ordering investigations, they come out with, although it is very rare to find tumors in these young girls, but yes, these children, it should always be in the back of the mind of attending physicians that girls of less than 10 years age also can have ovarian tumors.
So health awareness is spreading, sir. That's good. Sir, nowadays, the girls are, nowadays, on the girls especially, not girls, everybody, every child, especially we are talking of girls, there is too much stress, sir, of studies, of like other extracurricular activities which were absent during Corona times, but although there are so many, and their social networking and media exposure, still, as you said about menarche, the first menstruation, the girls are not aware about that, and even the parents do not guide about them. Can you tell us that what is exactly menarche and what is the role of parents and how the girls should manage it, sir?
There is a transition from the childhood to the adolescence, and that period of the transition is known as the time of change. So it is marked by 3 or 4 kinds of changes in the body. One is adrenalarchy, that is the development of adrenals. The thelarchy, that is development of the hair. And pubarchy is overall development of the girls. And the flag sign of all these changes is the menarche. And menarche is the time when actually they start with their menstrual cycles. And the menarche is a definite term which is given to the first menstrual period. So that is one of the ways parents come to know that this child now has started growing, and there are certain problems associated with the menarche, menstrual pattern, lack of. But anyway, I think parents now are more aware about the menarche and menstrual hygiene, and how to advise their children about how to react to these because. These little girls who are around 8.5 to 10 years of age, they are usually in a very, very startled state of life, that what is this event that has started, because they don't know. But now education system also includes some insight into the menstrual changes and these changes. So children are almost with the electronic media, YouTube and other things, so children are slightly more aware than they used to be in past.
You're appropriately right, because social networking से हमारी awareness बहुत ज़्यादा है, but still there is role of parents, especially mothers. So what the mother should do? I know they are educated, but still some mothers need to be advised. हमको भूल जाता है what we need to advise our daughters. So please, can you guide us?
Yes, one of the now let us understand what are myths regarding the menarche. Even mothers have some certain myths that she started having a cycle very early, and would the growth be stunted, or is it okay to have cycles at such a younger age, or is there any hormonal problem which is associated with such an early onset of cycles, or maybe even if the cycles are delayed, they are very much concerned about to rule out any medical problem. So that is kind of education they require. And second is the nutrition part of, because one of the things which I read very recently was that if these little girls are anemic, and this anemia is one of the causes of their poor analytical assessment of what teacher is telling them. So their performance in the schools is dependent upon their hemoglobin status, and especially in the mathematics, arithmetics. It has been a study that if if the students, they are anemic, the girl students who are anemic, and for that matter, boys also, if they are anemic, they are poor performers in mathematics and arithmetic as compared to ones who are not anemic. So this is just an example as to how they should manage the menarche, how should they counsel them, because they require mother as a psychological teacher for them, and they can really convert this tormenting time into an easy time for these children. They can guide them, and at the same time take care of their nutrition and anemic status, because this is a school going age, and lots of responsibility of learning, lots of conflict is in the mind of child, and it is the mother or even the father or even the society can have an opportunity to act as a buffer for them and make them stable during this period of transition.
Sir, one thing I want to say, you said about anemia. If you say today, sir, आजकल junk food, pizzas, burgers का ज़माना है. Obesity is also a very important aspect. So, does obesity play any role in menarche? Does it delay menarche or earlier? Sir, can you guide us?
Yes, Dr. Sabita, that is a very important question. There are two epidemics. One we have faced just now, pandemics. One we have faced just now, and we are over with it. And second pandemic which we are having is obesity amongst children. So definitely, as a physiology teacher, you know how much impact it has on the hormonal levels. I mean, they can really alter the menstrual functions, and it can be one of the important causes for delay in the cycles. And now, if you medically term it, it is not only obesity, but PCOD is coming as a very, very large challenge to the management of these little girls. So PCOD is one very important thing which delays and which disturbs the metabolism as well as the future reproductive performance of these girls.
You said PCOD. So what is exactly this PCOD, especially for common people? Like they most of the time they say कि बाल मुंह पे आ गए, delay हो गया, थोड़ा सा obese है, PCOD हो गया. But can you exactly tell all the us females that what is it exactly?
See, what is happening is that we people are meant for right from the beginning of our lives. We are meant for two things: eating a measured amount per day, it having calories which are prescribed for us, and then doing a bit of exercise, bit of walk or exerting at the physical level to a optimal level. So with the availability of things around us, with the mobile app, with the ordering facilities, I remember, you know, when we were children, we used to have breakfast in the morning and then probably have dinner at night, and something to eat in the afternoon. But there was nothing available. We could not ring up somebody to give us food. If mother was sleeping, then you used to wait for the mother to get up and give us food. So now things are available. Even if parents are away, you know, children have a facility of just dialing and get anything which they want to have. And they can have food any number of times, and with the commitment to their studies, they have become sedentary. They have learned how to study harder, but at the same time not learning as to how to physically exert. So these things are having impact on the metabolism, and the hormones, which are basically essentially female hormones. There are certain hormones which you know very well. They are like testosterone, they are like estrogens, they are like SHBG. So these are altered, and the net result is that there is accumulation of male hormones in these female bodies. And because of that, there are certain changes which take place, and obesity is one of them. And then hirsutism is another one, and acne are the third one. So, you know, we have to be very watchful. The mantra is that you should not be taking fast food, because Italian food is not meant for Indians. Chinese food is not meant for Indians. As Italians don't take Indian food, we should also not take you know, these continental foods, because in the end, you know, what dietitians are now telling children is that you should eat whatever your grandparents were eating. That is the good way of thinking, that your grandparents were eating things which are available locally, and they are available easily, and they are grown in your own regions.
Yes, sir, you are absolutely right. हमारी Indian थाली with all those अचार, पापड़, दाल, सब्जी, फुल्का, चावल है ना. Sir, मुश्किल है बच्चों को समझाना. But sir, like, sir, just tell that this polycystic ovarian disease (PCOD) is it curable? Because क्या होता है, परेशान हो जाते हैं, माएं परेशान हो जाती हैं, बच्चे परेशान हो जाते हैं. तो is it curable?
Yeah, it is very much curable. I tell my patients that if you have to cure your PCOD, then depend 30% on the doctor, and 70% you depend upon yourself. And for you, you have to understand two things: that you should be physically exertive, you should know about your calories, you should know about your glycemic index. Glycemic index of the food is very important. So you should know about glycemic index. You have Google facilities with you. Whatever you want to eat, you can see the glycemic index. And second thing is that how much to exert. Your different ways of exerting these days, physically exercising. So you can exercise, but at the same time, you should take your diet. There are many young girls who ask, we have started gymming. So gym is the commitment rate in joining a gym is about only 5 to 10%. It has been studied that if 100 people join a gym, after 3 months, 95% people leave the gym, and only 5% who are mentally strong enough, they continue with that. So they should have, and then it is going to a gym is costly thing also, not within the domain of every parent. So what they can do is that they can use certain methods like stair climbing, like using ropes for skipping, and then walk on a road, and then running, then jog, and those things they can. But one important thing is that for if you want that something, you want to do something, you start doing it, do it for a month, it becomes your habit, and you do it for 3 months, and then you call a lifestyle change. If you are able to do something for 90 days, you change your lifestyle. And it is the change of the lifestyle which is important. So when we ask these girls how you are losing weight, they say that we exercise a lot, but we don't lose the weight. Problem is that it is only after 3 months you just start losing weight. So you have to continue your plan of lifestyle management, whether it is food or it is the weight loss. It has to go beyond 3 months and make it a lifestyle. You can't, because there are certain problems associated with PCOD in the long term. We discuss in the due sometime. So you have to be lifelong. It has to be lifelong. So it has to be a lifestyle change.
Basically, lifestyle modification, sir. Sir,
Yeah.
another we are talking about the different age groups. Sir, adolescent population is proportionately increasing, and it is considered very special. So, especially for females, sir, what are the common psychological problems associated with adolescent group, especially in females, because the body is changing, their hormone is changing. Sir, what you encounter at your level?
It's a time of total confusion in the adolescent life because they are undergoing changes as far as the hormones are concerned. They are required to perform better in the schools, and the work pressure is there, peer pressure is there, parental pressure is there. So as ACME teaches us that ACME teaching, which I have always carried in my mind, is that as you cannot label the small children as young adults. A child of 5 years, you can't label that child as a young adult. Same the way you cannot address these adolescents as grown-up children. So one of the confusions is that these children who are these people who are around 16 to 18 years of age, and we address them as oh, you are just common, and then they react is they always say, oh, no, I'm not a child. So they are in confusion with the parents, they are in confusion with they are to be treated like young adults and responsible adults who are capable of self-directed learning, as you tell. So we have to just guide them, and then they can do their self-directed learning and become lifelong learners. So you have to become lifelong learners as far as your health is also concerned. So we have to address their psychological problems, we have to address their physical problems, we have to address their academic problems. They are trying to adjust in this society, and mother has got a great role to play in this age group also.
थैंक यू सर. सर एक चीज मैंने बोलनी थी, जैसे हम बच्चों को, जैसे आपने बोला एडोलेसेंट ग्रुप के लिए हम बोलते हैं अभी तुम बच्चे हो, किसी बात के लिए बोलते हैं तुम बड़े हो गए हो, सो दे आर कंफ्यूज्ड. सर मेरा क्वेश्चन ये है स्पेशली कि आप, यू आर अ बिजी प्रैक्टिशनर, यू हैव लॉट्स ऑफ पेशेंट्स इन द हॉस्पिटल ऑल अराउंड. सर ये बच्चे एडोलेसेंट्स आपके पास कोई प्रॉब्लम लेके कभी आए हैं, दैट साइकोलॉजिकल प्रॉब्लम अफेक्टिंग देयर फिजिकल हेल्थ आल्सो? Do they come to you, these young girls?
Yes. They're very important question. Dr. Sabita, when we were in medical colleges, we were studying or maybe doing our internship or early PG. So the scene used to be that a lady used to come, and behind that lady used to be a small little girl. And the girl used to be shy and absolutely silent. And the mother used to tell that this she's my daughter and she's having these problems, menstrual problems, discharge problems, or other health issues. Now you have time when these little girls, adolescents, they enter my clinic or hospital. They come in and they tell the mother, okay, mom, you keep quiet. Let me explain my problem to the doctor. And then they tell doctor, this is my problem. And they are so clear about it. I mean, they are read also. They have gathered information from the YouTube also, or from the Google also, and they very confidently discuss. I'm talking about an age group which is 15 to 20, and you know, it's a pleasure talking to them and analyzing their problem. And they are totally confident in discussing any kind of problem with doctors. And this is now happening with about 80% of the adolescents. 80% of the adolescents.
It's okay. Some come to you. Still, there are 20% who do not come to you.
Yes.
So how
20%
can 20%? So how can they manage at their places? They might be shy. They may not be aware. So what they need to do?
No, what they do is that they send their mothers, and then the mothers tell the complaints to the doctor.
Indirectly.
And indirectly. But then, you know, if you call them again, tell the mother you try to, and then they are able to make it with the doctor. Yes, there are few young girls who tell their mothers to talk to the doctor. And, you know, we make them, but in a due course of time, they are quite, you know, comfortable with doctors. I being a male gynecologist, you know, I find if I find lesser difficulties, I think female gynecologists, my colleagues, they must be doing much better with these adolescent girls. And I think their level of comfort with these doctors would be 100%. If it is if they are able to talk to me in 80% of cases, I think 100% with female doctors.
सर आपने शुरू में रिप्रोडक्टिव एज ग्रुप की बात की. सर एक्चुअली क्या है कि you said menarche occurs very earlier nowadays, and then there is a menopause when the menstruation stops. So people are, especially the females, are totally confused that what is this reproductive age group? Can you tell us what is this reproductive age group exactly? And it varies, it's not fixed, something like that, please.
Yes, I tell you that theoretically you go, it is that from the age group of 15 to 44, we define the woman age into a reproductive age group. But the problems associated with the reproductive age group may go 2-3 years prior to 14 years also. And there are some problems which girls face much earlier. Problems which are peculiar to the reproductive age group, they may face them earlier also. But if you say that 100% the reproductive functions, we say that somewhere 15 to 44, we call a reproductive age group. Your video, please. Video. Audio.
So you said that theoretically there is a fixed age group, but it slightly varies, and
Yes,
subjective variations are still there.
I would be more open with it. There are certain pregnancies which are reported even before 14 years, but the incidence is quite low.
Sir, आजकल इतना stress है, and I have seen that during this some working hours as well as study hours are lost to because females are suffering from menstrual problems, especially like dysmenorrhea, what we called as sickness absenteeism. This is very common nowadays. So what are the common menstrual problems and what should females do? Because even I'm a teacher in medical college and students come to me, ma'am, I'm down, mujhe menstruation ho gaya, I can't attend classes. In office, my clerk comes to me and says, ma'am, I'm not able to sit here. So how can they manage that? Please guide us, sir.
I think this is a very common problem, the sickness absenteeism, because of adolescent gynecological problems. The problems are like when they become menarche starts. After that, they may have abnormal uterine bleeding for some time, known as it is pubertal bleed. These are they have menarchal problems. Adolescents have menorrhagia. So menorrhagia may be one, puberty menorrhagia may be one of the reasons for sickness. Absenteeism, dysmenorrhea is another one, right? So in schools, dropout rates, there may be some dropout rates from schools as well. They should consult doctors and take whatever logical medicines are. So there are very good medicines which can reduce the dysmenorrhea, the degree of dysmenorrhea they have. So they can go to doctors, get their investigations done. There are two types of dysmenorrhea. One is primary dysmenorrhea and second is secondary dysmenorrhea. So we are more bothered about these adolescent girls having primary dysmenorrhea. Unfortunately, in primary dysmenorrhea, majority of the times no cause is found, and it is the psychological basis. Prostaglandin may be released up to higher levels. So we now call it not only dysmenorrhea, we call it PMDD, that is premenstrual dysphoric disorder. So not only dysmenorrhea we should focus at, we should focus at other problems also, like menstrual migraines. We should talk about menstrual psychological disturbances, mood disturbances, menstrual blues. We should talk about bloatedness of abdomen, diarrhea, pain in around the thigh. There are many symptoms which we come across, and we should address them by their diet, reassurance, medical advice, medicines, NSAIDs. They can use them and they remain quite comfortable.
Sir, about dysmenorrhea especially, you said it should not be taken lightly because क्या होता है अगर लड़की को dysmenorrhea होता है, उसकी मदर बोलती है या घर में उसके female relatives बोलते हैं कि ये तो normal है, कोई बात नहीं. So if it occurs continuously and if it leads to sickness absenteeism, she should go to a doctor, she should consult?
Definitely. The idea is that she should not suffer much. If she is able to tolerate the pain, if there's less pain, and then she can do without medication also. But once it goes up to the level that it is grade 3 dysmenorrhea, she should consult doctors, and especially to find out what is the reason actually.
So one, we heard about premenstrual syndrome and you talked of different symptoms. So can they be listened? There is some medication by this premenstrual syndrome, which is bloatedness and pain in thighs and all those. Can it be decreased with certain medicines?
Yes, Dr. Sabita, it is somewhere. See, if you try to understand the etiology and mechanism of these premenstrual disorders, it revolves around the hormones only, the estrogen, the progesterone, and the prostaglandins. So there are different kinds of prostaglandins. So what you have to focus is that if the constricting prostaglandins are released to a higher extent, so what we can do is that we can give certain NSAIDs And but it is important to start them probably a day prior to when they actually have the symptoms. So they are more effective, and we should tell them to keep NSAIDs with them and at home. And whenever they have beginning of the pain, they should immediately take.
Sir, I have read somewhere that certain vitamins can lessen this premenstrual symptoms and premenstrual dose. Is it there,
Yes,
sir?
yes, yes. We are using lots of medications which are, I think they can be good co-prescription, but not the prescription as such. So co-prescription, there are certain vitamins which are quite helpful.
Can you vitamins, sir, which the
Vitamin, almost every vitamin has been worked
vitamins.
up. So vitamin E has a role, and
B complex group does have a
B
role,
complexes group also has a role. Yes, but it is not that to that extent that it can be taken up as a primary treatment.
So co-treatment, part of co-treatment. Right?
Co-prescription, yes.
It may sort of preventive, maybe.
Yes, it can be helpful.
It can be helpful. Please, participants, if you have any question, put them in the chat. We'll discuss in the end. Thank you. Sir, this was about dysmenorrhea, and menorrhagia and is a very common complaint of most of the females. So can you tell us about that?
Yes, I told you about the puberty menorrhagia. So this menorrhagia continues in the reproductive age group also. And, menorrhagia has been, there's a new classification of abnormal uterine bleeding which has come. And we can divide into acute and chronic abnormal uterine bleeds. And then there's a Palm-Cohen classification, and that classification, determines as to what is the reason for abnormal uterine bleedings. So they can be they can be divided into various types, whether leiomyomatosis is the cause, whether it is different causes are there, whether it can be ovulatory or there can be adenomyosis. So we have to keep in mind, as we have a classification of abnormal uterine bleeding in adults. So part of it we can apply to the young adolescent girls also, but the majority of the cases it is only puberty menorrhagia.
So menorrhagia means bleeding, excessive bleeding.
Yes, I like to classify. Like to classify what we understand from various definitions. What do we understand from?
Sir, in a layman language, please.
Yes,
can you tell us what is kya hota kya exactly marriage? You can explain in Hindi also, sir.
Yes, I will. If the girl, let us be specific to the adolescent, if she has a bleeding which lasts for more than 3 days, if there is a bleeding which is more than 80 ml in a day, or if she has to change 2 to 3 pads in a day, we would consider that to be a menorrhagia. Then there are frequent cycles that menorrhagia she may get for 2 to 3 days, she may get every month, but there is cyclicity is maintained. So if she gets a cycle in between cycles also, we have terms like metrorrhagia, we may have terms like polymenorrhea or polymenorrhagia as well.
So it depends upon the age group also. You were talking about young girls. अगर वो late stage में हो, 40s में हो, 50s में, 30s में या early 40s में, तब sir?
No, classification of bleeding remains the same.
Same. मतलब same.
Yes, it remains the same. Adolescent
okay.
and old age, it remains the same.
Okay. Thank you, sir. Sir, we have heard about immunization in females against certain cancers, and most of the time it is advised to prevent against these cancers. So can you tell us specifically what are the different cancers seen in females, and what are these vaccines available, and which their females should take?
Yes, I think our today's topic was more dedicated to the cancers in women, but I thought, and me and Dr. Sabita decided that on Women Day, let us not talk only about cancer. Let us talk about healthy things as well, good things which they have. And cancer is one of the threatening things, and that is why we did not only talk about cancers. So cancer of a woman, any women age, at any age they can have cancers. We have different organs for that. If you include breast also, then breast cancers are there. then uterine cancers are there, cervical cancers are there, ovarian cancers are there, and then we have vulval cancers and vaginal cancers. So there are specific age groups in which you have different kinds of cancers. So like younger age group, you don't expect them to have cervical cancer, or you don't expect them to have a uterine cancer. What you do really expect them to have is very, very rare ovarian tumors. Like same way in adolescent girls, you may not have the cancer I just mentioned, but ovarian tumors still, because ovary is a very fast growing organ and there's high levels of cellularity indices it has. So they may have ovarian tumors. Tumor is a benign thing, and the cancer we usually say for a neoplasm. So there are different kinds of cancers. The screening programs are there. There are few cancers for which we don't have any screening programs. But overall, we have to divide the cancers into two categories: ones which are benign and one which are malignant. And for malignant cancers, fortunately, there are certain cancers for which you have a proper screening system, and there are others for which proper screening may not be there. So one of the cancers which I want to talk about which is a worldwide, we are concerned about it. That is the cervical cancer. Let us start from the cervical cancer. Two very peculiar things about cervical cancer are that cervical cancers they don't occur in a day. They take a very, very long time. And the long time means that they may take 10 years, they may take 20 years after the exposure to the pathogens. And during these 10-20 years, we can do lots of screening on them. Why we can do screening is that one thing is we must understand that cervix is a very, very accessible organ, and there are very, very strong, which are specific and very sensitive tests, screening tests available, which have very low false negative rates, and they can be applied to women, and their results are too good. Cervical cancer has got various screening methods. One is the pap smear, the age-old pap smear which was done, and the modifications are liquid-based cytology, which is a cytology, and this cytology can be done very efficiently, and we can assess the cells. And there are other methods which are available, like visual acetic acid application, VIA. VILI is visual inspection after Lubber's iodine. And there are so many other methods. Colposcopy is one of the very, very good methods of assessment. Fortunately, at GMC Kathua, we have a colposcope now. And, we can know about this cancer. Now, what is the difference between cancer, cervical cancer in the West and cervical cancer in India? Is that in developing countries, in developed countries, you are able to pick up cervical cancer in a developing stage. But in developing countries like ours, we always pick up these cancers in a developed stage. So our attitude has to change, and we have to really work up in a way that we are able to detect them early. So what happens is that when there is a sexual exposure, when the girl gets married in a younger age, if there is an exposure to certain viruses, and these viruses are known as human papilloma viruses, and there are strains of human papilloma which may be harmful. There are certain strains which are not harmful. So if we are able to use immunization for the human papilloma virus and at a proper time, then these girls may not have cervical cancer even after exposure to the human papilloma virus. So what human papilloma virus does is that it controls the genome of the cervical epithelium. So which is a squamous epithelium, and then the cancerous changes, they start taking place. But if they have a proper immunization, then probably they will not develop this even after acquiring the infection. Now, important is what is that age when they should have immunization, and how effective is the immunization. These are two things which come to mother's mind or the health personnel mind. So it is important that you get them immunized in a very young age, say in adolescents only. But then by around 28, 29 years, you can really inject them. But better is that if they are, immunized in an early age. So what are various options which are available for the vaccination? They may be monovalent vaccination, or they may be polyvalent vaccinations. So we have vaccinations which are specific to the offender HPV DNA viruses. So and then there are vaccines which are effective against all kinds of HPV viruses. So they are to be given over a space time that they can be used at the 0 month, 2 months, and 6 months. There are two vaccinations which are available in the market, and they are by the name of Cervarix and Gardasil. Cervarix is, effective against less number of HPV DNA, but Gardasil is effective against. Now, why are they effective? Yes, they are effective because what has happened is that Australia has been a country which has really controlled the number of CA cervix just on the basis of vaccination. Our problem in India is that India is a large population, but still, vaccinations are available, but they are still slightly costlier and beyond the range of a common masses. I hope that in future, Government of India comes out with a vaccination program where vaccines can be given, as we did in COVID. A less costly vaccines should be available for CA cervix, and that would be the day when our population will be CA cervix free. There are no vaccines available for other kind of cancers like the ovarian cancer and the breast cancers and the uterine cancers. But there are certain ways of predicting these cancers. There are certain ways how we can do it, which would be beyond the scope of our discussion today. But what is important is that women by large, they should be more aware about cancer, and they should get involved in their screening procedures. We should make these reproductive age girls aware by their education system that as to they can always define whether they are high risk for some kind of a cancer or not.
Nice, sir. I wanted to ask you two things. दो चीजें मुझे पूछनी है. सर, आपने दो वैक्सीन्स का नाम बताया. If a person can afford, अगर वो खरीद सकता है तो कौन सी वाली प्रेफर करनी चाहिए? तो
yes, because there is a difference in their cost and their effectiveness. I think if you talk about Cervarix is very effective against the CA cervix. But there are certain other problems with the HPV human papilloma virus DNA, and those problems are non-cervical, like anal condylomata, and then oral condylomata, and then pharyngeal condylomata. These are the conditions which are talked about, and that is how these vaccinations are having scope in boys also, right? So there are certain problems with the sexuality in boys also, so they can be used. And if you have to use for all the kind of the outcomes of this infection, so then you can use a polyvalent or a Gardasil.
Thank you, sir. So दूसरी चीज मैं आपसे पूछना चाहती हूँ. You said about screening. So at what age, reproductive age, a female should start her screening? What is the ideal age? And at what gaps, like 1 महीने के बाद करना चाहिए, 2 महीने के बाद? And please guide us.
There is a protocol for that, and that protocol is practiced differently in the West and practiced differently in our countries. So why there is a difference between in abroad, you know, they don't talk about much about the marriage. They talk about the sexuality. They say that if the woman, the girl becomes sexually active earlier, so they should start with this screening program, and that screening should be done every 2 to 3 years. But in India, we always talk about marriage, and we talk about if when she gets married, ideally, if she can get it done, she should get screened almost every 3 years. But in India, you know, acceptance rates of the screening programs are much lesser, and it is very difficult for us to convince a lady of young 20s that you should get screened. I mean, there are girls, not the picture is not so dismal also in our setup, but girls are coming out to us who are in corporate sector or who are working, who are knowledgeable. They get their voluntary pap smears done. But we can have always programs in India. I think even if you can do it for once in 5 years, it is good enough. But important is that after the age of 30, you should not only do a pap smear, you should do a pap smear with a HPV DNA as well. That is known as a hybrid kind of approach to the screening of CA cervix, in which you analyze that what kind of HPV DNA is affecting a woman. So there are various methods which can be taken up, and it should start with the early age, even the screening, and continue somewhere till 40 years, till the tests are negative. I mean, 2 tests are negative. But in India, a peculiar thing is that CA cervix has a bimodal presentation, unlike the West. And in India, the screening may continue even up to 40, because we have cases who come up with CA cervix after the age of 55 and 60 also.
सर एक चीज और आपसे पूछनी है, हमने बोला we should go for screening. Is this screening easily available in government hospitals?
Yes, government is very sensitive about it, and the pickup rate of CA cervix, the CA cervix are very high. We have various changes which take place before CA cervix, and we are all aware about CIN 1, 2, 3. If we are able, and even carcinoma C2, if you are able to detect them in early, the changes, when we are able to diagnose changes in the cell, or maybe cancer in very early microinvasive stage, the treatments are very, very effective treatments are there, and long-term survivals are there. Your question is that are they available in our setups?
Yes.
Yes.
In hospitals, normal government hospitals. Yes.
Government is sending you if you go by the NMC guidelines, and NMC guidelines are making these things are available. There is a special emphasis on what is the requirement of gynecological department as per the NMC guidelines, and it says that you should have a colposcope, you should have LBC kit with you. They should be available. The pathology department should be. I think these are all available with us now. Even if they are available in a place like Katuba, I think they are available everywhere.
That's good. That's good. तो ये तो सर बात होगी government hospital की. Suppose a person feels shy, doesn't want to government hospital. So what is the ideal cost of this screening process? Rougher cost.
In West, I said that it is very expensive, but in India, see if screening program gynecologist taking a screen in his clinic, it costs around 400-500 rupees, and then you can send it to the pathologist, and according to the test which they do, whether it is LBC or whether it is a papillary staining. So the cost is around maybe 15 or 2,000 rupees. So somewhere, if you talk about it, it will be somewhere around 2,500 or maybe 3,000.
So इसका मतलब पूरी फैमिली मूवी देखने जाए मल्टीप्लेक्स में तो उतना ही कॉस्ट पड़ेगा, है ना सर?
Yeah, true.
पॉपकॉर्न नहीं खाए, मूवी नहीं जाए, बस ये करवा ले, है ना सर?
Oh, it is worth it. And
is
these
worth
these
it.
2,500 rupees are worth it.
Worth it. Thank you, sir. Sir, one thing very important is that pregnancy is a very important part of a female. She gets married and wants to produce a child, and she gets pregnant. So what precautions she should take during pregnancy?
Pregnancy is a very different kind of a time, which it is a journey towards the joyous end, and it is I think women are very happy when after their marriage they become pregnant, and but we have to be very cautious, because pregnancy is a very difficult time as well as at times. So we have to keep the complications in mind, and at the same time it is just like boarding an aeroplane and saying that as a doctor you can be just like a air hostess, and you can say that I welcome you to the on board, and I can you enjoy your journey, and we are there to serve you in your journey. But then there are certain precautions you have to take care of. You have to fasten your belt, and you have to these are the gates which are there. I mean, that kind of a scenario is there. We have to tell them it is a very safe journey you are going to have. This is your expected date of delivery, but be watchful that there can be hypertension, there can be APH, there can be abortions, there can be, we can tell them and what precautions they should take, and how to when to consult the doctor again and again, so that they can minimize their complications. One very specific group which has come up as far as pregnancies are concerned, women are now career seekers. Women delay their pregnancies to a later part of their life. So very common for having women who have had the precious pregnancy after the assisted reproduction, and in an age which is more than 40, the complications are slightly higher, and doctors have an added responsibility of telling them as to how to take care of their pregnancy.
आपने बात बोली airport, like we are on pregnant female is like boarding an aeroplane, and but problem क्या होती है सर, ये जो passengers हैं, especially the females, sometimes they press the button too much. Like doctors are air hostess, they too frequently want to visit the doctors. So what is the ideal time or ideal visits to the doctors? जैसे छोटी सी बात पे they create a panic, and ideally when should they, जब कब उनको doctors के पास जाना चाहिए?
Yes. So what is important is that that is a panic time. Pregnancy, where they are more concerned about their unborn baby. So they are concerned about small things as to their actions should not affect the well-being of their babies inside. These small concerns like dyeing their hair, or having aloe vera juice, or having ice cream at night, or having a dinner in a club at night, excessive coffee taking, or even there are few people who drink also. And these are the concerns which they have. They want to know whether they should do it or not, and would it affect their babies. Panic is always there. Even if they get itching in the body, they are worried as to, is it going to affect their baby. But if you talk about the prescribed time as to when they should consult the doctor, there are 3 trimesters, and the first trimester, second trimester, third trimester, and 9 months of pregnancy. And if we divide them into 3 months, then we can always say that they should visit the doctor almost every month in first 7 months. And then after that, after 7 months, they should consult every 15 days for another 1 month. And then in the end, when it is 9th month, they should consult every week. But this is different from patients who are actually having a high-risk pregnancy, wherein they should come to the doctor every 15 days if it is higher risk, and then every 7 days till 8 months, and get admitted after 8 months. In India, it is very difficult for women because they have multiple roles, like Ma Durga has. So they have multiple roles to play. They have their homes, they have their workplaces, they have their children, they have their society, they, lot many responsibilities they have to look for. So we request them, and then, certain dependent women, they require somebody to take them to the hospitals. So 11 visits in or 13 visits in a pregnancy would be much more. So they can come at least once in every trimester. And Pradhan Mantri Yojana is there. 9th of every month, we try to find out high-risk patients and try to have their telephone numbers on the portals so that we can not miss these high-risk women. So at least once in one trimester would be minimum, very fine, and that is what we call booked cases. But despite these guidelines, you have certain women who are from far-flung areas and low education status and low socioeconomic status who remain unbooked cases even today.
Okay, sir. So that's nice, sir. One thing more, we have seen that exercises during pregnancy, certain exercises during pregnancy help the pregnancy or for the parturition or the delivery process. Sir, are these beneficial, and are we having like in hospitals training for these exercises? Is this available?
See, what is said is that in pregnancy, early pregnancy, whatever you are doing, if you are accustomed to a particular exercise, even if you are a speed runner, you can continue with your exercises till you can. But don't start with new exercises. And as the body is challenged, there can be problems. So there are certain exercises. One exercise which I tell my patients very commonly is a cat and camel exercise, which can be done almost while being in the bed only, to stretch the back and flex the back, and the shoulder exercises and leg exercises, squatting, butterflying. These are the exercises which can be done without training also. But then there are professional trainers who have very wonderful exercises for pregnant women. There are Lemaze breathing techniques which can help these ladies have normal deliveries, as well as have control on their breathing when they are actually in labor. So there are exercises now which are considered good for normal labor. But unfortunately, in hospitals and even in clinics in our area, we don't guide them much, because I think we guide them to some extent, but we don't have facilities for them to have proper exercises. But there's a midway solution which I have found for my patients, is that I advise them to go to the Google and explore for them various antenatal exercises as well as the postnatal exercises, which are doable. I tell them that you see all the exercises and you decide for yourself which are doable by you. And if you want any queries regarding that, you can come and ask me. That is how I do. And then we have certain, physiotherapists who are in with us. We can always take their guidelines and send them to do exercise.
Thank you, sir.
But yes, strenuous exercises, with lots of pressure on the belly, they should not be done. One very important aspect of exercises which I would like to discuss here is the Kegels exercises. We have pelvic floor muscles comprising of 3 subsets, and MRIs have been done, and lots of studies have been done, and it has been seen that if you do Kegels exercises every day, your pelvic floor muscles will develop as your biceps and triceps can. There is actual increase in the size of the pelvic muscles, the levator ani, and the vascular studies have been done, and they have found that actual vascularity also can be increased up to the age of 60.
Yes, sir. So you talked of Kegel exercises. Being a doctor, I know, but as a common person, what is this exactly, Kegel exercises? Can you guide us?
Kegels exercises, Dr. Kegel started these exercises, which are initially only limited to the RVO, that is the relaxed vaginal outlets. So what Dr. Kegel used to do was that they used to take balls of different sizes, and they used to place inside the vagina and tell the woman to stand. Initially, if larger volume of a ball was in there, and she, then different smaller sizes were used, so that that pelvic floor was able to hold those steel balls. But anyway, later on, what they learned is that that was a cumbersome method of telling these exercises. What now can be done is what Ramdev ji teaches, or other yogis they teach, the exercises that you can hold the urine and you can hold the rectal area for some time, or counting 10. You can hold it for some time and then do repetitions. So I think that can be one form of pelvic floor exercises. And then there are many other ways. Or you can hold a pillow between your knees and you can press those knees, and then those are also exercises. One can stand and squeeze the gluteal regions. So that can be one of the pelvic floor exercises. But if you talk about Kegels was a specific exercise which now have different kinds of applications.
Thank you, sir. Modifications have been done.
Yes.
Sir. Now, going from pregnancy, sir, another very important issue is contraceptives. So what is the best, or we can say good contraceptives to be used, sir?
So why contraception is important, that in our life we have to have a pregnancy which is planned, and which is a desired pregnancy, and it is not a pregnancy without any it is a pregnancy by choice. It should not be a pregnancy which is not planned. So I would, in this discussion, I think this discussion would be very, very appropriate to mention the menace of criminal abortions, and small girls of adolescent age, or even ladies of reproductive age group, when they have unplanned pregnancies, they go for abortions. And unfortunately, for some time in India, the abortion laws were not very clear. So these little girls, or maybe young girls, they used to find a backstreet abortionist, what we used to call them, and they used to find them, and then they used to get abortion. Then the incidence of criminal abortion and the mortality with the abortion was too high in India. So contraception, if I look at contraception, it can be a very, very good method by which we can always rule out the unwanted pregnancies, and even if they are available for the young adolescent girls as well. Different methods are available. There is no one method which is suitable for everybody. So the basket of contraception has always been changing throughout the world, and more so in India. So what is this basket of contraception is that you must be aware about the different methods which were there. There may be oral contraceptions, there may be reversible contraceptions, there may be irreversible methods of contraception. To name a few, there can be some oral contraceptive, there can be sequential, there can be triphasic, there may be non-hormonal kind of contraceptions, copper T, which is IUCD contraception, and there may be permanent methods like sterilization. There may be a male contraception which can be considered. There are two types of male contraception. One is a permanent, that is the vasectomies, and a reversible, which is rice soup these days in India. So it is like a cafeteria approach. In cafeteria, you always go there, and the person who is attending you in cafeteria doesn't come to you and say that, okay, madam, you take potatoes and cheese today, or sir, you have only chicken today. They come to you and they say, okay, ma'am, these are the things which are available, and what would you like? What suits your psyche? So as a doctor, you also have to ask them what is suitable for you, because there are certain myths associated with contraception as well. So see, there is a large group which has myths against copper T. So if you tell the patient that no, I'll give you copper T only, so patient has to decide, a couple has to decide that what contraception they would use, how many children do they want to have, after how many children they would be going for a permanent solution, or if there's a girl who is unmarried and she is in a relationship, what kind of contraception would she like to use, which should not affect her. You cannot expect a girl of around 19-20 years to have a contraception which is having hormones, and she would develop melasma on the face, or she would develop obesity for that matter, because those are not the welcome things at her age. So if you're talking about somebody who's at 35, 38, maybe it doesn't work for them also, but anyway, you can explain to them. So then when they have decided, you can tell them how this method is not going to suit you and what method you should. It has to be counseling, and it has to be an agreement between the doctor and the patient, and they have to agree that what contraception can be the best. To name a few contraceptions which are working very fine these days, one is injectable contraception, and that is the injection Depo-Provera, serving very fine. I mean, the Pearl index and the incidence of failed pregnancies are much lower. Oral contraceptions with estrogen levels which are very low, they can be used, and even up to estrogens up to 15 microgram have come up, so they can be used. There are certain new progesterones which are available, and those progesterones are very, very fine. They don't interfere with the lipid metabolism, so they can be used. So Centproman is another one, by the name of Saheli. Now it is called Chaya. And the wonderful thing is that these are all available in hospitals. One just has to go to the hospitals, and every remote hospital has got a good amount of governmental supplies these days, and they can be had.
It means that it is a subjective thing, and depending upon the choice, but contraception should be there.
Yes,
it should be used. That's
yes.
nice. And government is obviously doing its job, and we have to also do a job. So
there is an unmet need. I mean, unmet need.
Yes.
The population requires it, and government has got a will to do. Where we are lacking is as health personnel, we
communication.
Yes, counseling, communication, and education.
Okay, sir. Sir, pregnancy की बात हमने कर ली, contraception की बात कर ली. अब हम infertility पे आते हैं, sir. Sir, आजकल infertility is become common because, as you said earlier also in our talk, that females are getting married or in relationship late and going for kids late because there are job responsibilities, settling in career, and now infertility has become very common. Both females and males are having problems. And moreover, sir, itni mushrooming ho gayi hai infertility clinics ki that it becomes difficult for people to choose. So I'm asking you that to whom the couple should go? What should be the criteria for an infertility clinic if they have a problem, sir?
See, what we gynecologists are now educating ourselves in infertility as a separate, separate system of treatment. I mean, infertility is a very, very specialized treatment. Cannot be, done by anybody. It has to. One doctor has to train oneself in a very different manner. But anyway, we can divide infertility treatment into 3 phases. As medical system, we have a triaging of the system. So we can have level 1 infertility, level 2 infertility, and level 3 infertility. So level 1 infertility would mean that, diagnosing and treating, basic simple forms of infertility, like doing a follicular study, or maybe doing a semen analysis, or maybe doing a tubal patency test, and treating them accordingly. Laparoscopically, you can treat the tubal factors, or you can give a baseline ovulation induction. Then comes a level which is level 2, and level 2 would be that you can do IUIs, and you can do the ovulation induction with gonadotrophins, and ovulation induction you should be able to treat the hyperstimulation if it occurs. Then comes the level 3. Level 3 is really the infertility, which is assisted reproduction. So assisted reproduction requires the IVF, the ICSI, or other modalities which have come up. So we have to divide. I mean, it is responsibility of doctors to be honest and tell as to at which level these infertile couples can be treated, and not delay their treatment to a large extent, because I have seen few patients who the time flies very fast, and young couples turning into the infertile couples in the age of 40. It is very common. So we should not delay their pregnancy. We should treat their pregnancies in level 1, level 2, and then if they require intervention of level 3 infertility, we should, as gynecologists, immediately we should at the earliest we should refer.
So choose karna mushkil hai, but still we have to see the success rate or something like that.
Yes, success rates are there, and then I was reading one day, and for our diplomat program, which we have in Kathua also, and they were saying that if you tie up with the infertility center, that infertility center should be having a minimal number of cases per year done, and their success rate. So as a doctor also, you have to find out what are how many patients, what is their footfall, how many patients are they treating, and how many patients are actually getting treated. So I think that is one way of analysis as to how to choose. And every center should be honest about it. They should have information.
Statistics should be there.
Yes.
Statistics. Yes, sir. Sir, एक बड़ा important question है. मेरी खुद की curiosity है, because now the girls are not marrying, and हम, as an Indian parent, we want our kids to get settled.
Right.
So if they want to work and or want to be in a relationship or not, or they want a child, तो ये जो ovum preservation का process है, technique है, we see in movie stars going for it. Is it good and we should go for it? We should advise it. It is good.
See, it is very important that one thing you have to understand that I think pregnancy goes with the womanhood. Everybody wants, I mean, every woman wants at the one part of one time of their life, they should carry a pregnancy, and why not? Pregnancy is brings lots of physiological changes in the body, which are important, and it has been seen that if the women who have never become pregnant, they have a higher medical problems in their beyond 50 years of age. So yes, if somebody is unable to get married because of one reason or the other, they can choose
like
these.
Girls can keep their ovum preserved, and then later on, if they want to plan, they can go for it.
Yes, why not?
It's a safe procedure. It's not a problem.
Yes, they are safe procedures, and they are although all the hazards of medical world are there, but
yes,
they are not all that risky procedures as well.
Yes. So,
see, they have to decide about their needs of life.
Okay. Sir, now we talked of menarche, we talked of childhood problems, menarche, we talked of pregnancy, and now we want to talk a very important point, menopause, that is stoppage of menstruation. Sir, what are the common menopausal problems, and when should they come to the doctor? And this is a very important issue, I think. I'm also going through that phase, sir. So it's also a very important issue, sir, please.
See, women are precious anytime, whether they are young children, adolescent, or they are reproductive age group, or they are menopausal. They are always precious. As you lose on your youth, you gain on your grace. And I tell that they should accept the menopause very, very gracefully, because it is the age which makes a difference, but the motherhood is always there. They now is the time when they are required, and the motherhood is still there, and they can be great grandmothers. So what is important is that we should now there is a proper staging of menopause. We can really stage the menopause. We can address the menopausal problems more confidently, and as the word says, it is menopause. Me no pause. I should not pause. And if you talk to our worthy Secretary General, Dr. Sudha, she's from Jammu only, and she is doing a wonderful job in Menopause. And she says that, women should be productive at the age of 90 also, because they should be fit at 70 and productive at 90. They should be able to look after themselves, and that they will be looking after the family in total. So what are the problems of menopause? They are to be seen. One is that there is osteoporosis, second is cessation of cycles, and third is vasomotor flashes. The estrogen is one hormone which protects women from cardiac events. The incidence of MI is much more in men as compared to women before the age of 45 or maybe 50. But it's equals once they go beyond 50 and they have lesser estrogens in the body. So the risk of cardiac problems increases. The problems of cognition, women have estrogen working from their hair to their toenail. So once levels of estrogens are less, so they have problems like sleep disturbances, forgetfulness, irritability, and likewise other problems. So if we understand them, there's a good way of replacing the estrogens, that is known as hormone replacement therapy or ERT. So then there are certain sexual functions, the functions associated with the and cancer. There are certain cancers which are specific to the old age. So if you have a various systems, like now you have a DEXA scan in which you can scan the bone mineral densities, right? You have different hormonal assessments in which you can read those hormones and tell that how far is a woman away from the menopause. And there's a large period of perimenopause. So we can all, if you see the number of postmenopausal women in 70s and 80s having a hump which was known as a Dowager hump, it is very rare these days. You have women in the 70s and 80s also walking very straight as compared to what used to happen in the past. So that is the exercise. If they are able to exercise, they are able to, there are certain things which are available known as phytoestrogens. Now, what are the phytoestrogens is that it was realized that people in Japan, they have lesser menopausal symptoms as compared to other people. So they found that the phytoestrogens found in the clover oil, they were the protective. Soya, we have soya products, so they should have larger amount of soya products. They should have proteins which contain soya. So that should be what should be eaten. And exercise, yoga, deep breathing, like pranayam and all. They are Indian answers to the menopausal management. So they can be peptized, and women can be more productive and stronger in their post-menopause age as well.
Sir, role of calcium, sir. Calcium should be added into the diet.
Yes, calcium.
Vitamin D and calcium.
Yes, if I talk about calcium, it's a long journey I'll take. Now it is said that if you have to, like now we are working and we are creating a bank account. Me and Dr. Sabita both, we are creating a bank account, and that bank account is for a period of after 60, when we actually not be working, and what we will be spending then. We will be spending all that money which we have saved now. And I would advise all the women of this world to create a bone bank also. And that bone bank is that right from the adolescent age, that is known as Kishore Avastha for these girls. And there's a Kishore Kishori Yojana, in which they say that all little girls from the age of 10, they should be given one iron tablet every week and one calcium tablet every week, so that they, by the age they are, by the time when they are around 20, 22 years of age, and they are, and then they should, when they become pregnant, they should have enough levels of calcium. But this should not stop them here. they should continue taking calcium till the age of 45. And after that, when they actually start losing the calcium levels and bone density, the bone density will reduce much slower if they have taken calcium for a longer time, and it will be faster if their calcium bank or bone bank is not having enough resources. But yes, once they are doing exercise, once they are taking care of themselves, doing yoga, and calcium can be supplemented, and calcium works for a longer time with also with vitamin D3.
Sir, now we are coming to the finishing end to this interview. Sir, a very important aspect is what is the common sexual disorders which are in females we encounter? They come to you or to a gynecologist or obstetrician, sir?
Yes, you know, once if there's a well-lit room, and that well-lit room also there is a corner which doesn't ever see the sunlight. So this kind of the sexuality in women is that kind of a dark corner which never saw any light. But now it is a very important topic of discussion amongst the health personnel and health providers, and as well as researchers, the people who are doing lots of research as to not to ignore the female sexuality, because sexuality is also directly linked to the physical and mental well-being. So majority of the psychological problems which are, and the problems are they may be problems of desire, there may be problems of performance, and there may be problems which are having psychological basis, and these problems may become the source of conflicts, domestic conflicts. So they are to be addressed, and good thing is that they are, all of them are quite manageable. But they would require whose assistance, it is not very clear, whether the assistance would be from the gynecologist, from a general physician, from a urologist, or from a psychiatrist, or from a from the gym
Counselor.
or counselor, or that is to be decided. But I think majority of the things can be addressed. Like I would just give an example that if thyroid levels are altered, or if prolactin levels are higher, patient is having hyperprolactinemia, there may be the problems of desire or performance.
Sir, one more thing, the sexual problems, what they encounter after menopause.
Yes.
And how to handle them.
Yes, it is a very important issue, because number one problem which they find is that because estrogen levels are reducing, and once there is a reduction in estrogen levels, the vaginal mucosa becomes very brittle. And if you look at the physical color of the vaginal mucosa, from the pink, it starts becoming white or yellowish. And there is a decrease in the secretions, the lubrication, and it is a dry kind of mucosa. And the sexuality suffers once the patient starts, experiencing the dyspareunia. Once they start going into the postmenopausal age group, the incidence of dyspareunia is much higher. And then, majority of the people, they have in their mind that it is a taboo, it is a, activity of a younger age group. And, we are destined to be sexually not active after a particular age. So those things are changing as women are more active, they are more outgoing, they are, they give importance to the sexuality after the age of menopause, that the age of menopause also has increased, and that has gone to 53 years instead of 45 years. So more of a number of people are now encouraged to, they encourage themselves to get into intimate relationships. And because one important thing you must understand is that woman who has worked so hard, she must have sacrificed so many things for the career reasons. She might not have achieved an intimate relationship, but once now she calls up from work, and she wants to have in close relationships, or she wants to get married again, or married for the first time after the age of 55, I think we should be very considerate in allowing them and provide them counseling or whatever medical treatment is available
It
for
means they
to
should take
remain
advice.
sexually active. Yes, yes.
They should take advice. That's nice.
True.
Sir, my last question is, what is the role of this nutrition and exercise in female life? It is important in all genders. It's not gender specific, but I'm asking about female especially, sir.
Yes, it is important for everybody, whether it is children, whether it is adolescents, whether it is the men, women, any age. The exercise has got a specific role to play. They say that if you are able to, I think I would not be wrong in front of Dr. Sabita in saying that proprioception is one thing which involves the representation on majority of the areas of the brain. So if you move your joints and if you train your muscles and I think increase the blood supply to your muscles, I think the bones, if muscles work more, and they say that it is the ligaments who have action on the bones, and bones actually start working better. So in perimenopausal age group, say earlier, say after the age of 40, they should spend more time in exercising. So their 50s, 60s, 70s, and 80s, they are much better. When men can do sports and physical activities uh, of miraculous dimensions, even women can do that.
So means exercise and nutrition. We talked of nutrition earlier also, that it should be properly taken. The Indian diet should be used. You said that earlier also.
Yes, sir. Indian scenario has been slightly different. You also know, Dr. Sabita, that we have lived in times that see in our childhood when women around us used to ignore their nutrition and provide nutrition to the family, outsiders, and their children. And at times, women in very remote areas and poor socioeconomic status used to remain hungry for benefit of their families.
Yes,
so we have seen those times also, and now times are better. Food is more available, but important is that they should be made more aware about not only food but the quality and the type of food they should take, so that their body remains healthy for a longer time.
Sir, with this we finish, but we have two questions in the chat box. One is from Ms. Komal Chada, that how long hot flushes last post menopause and what should we do to get relief, sir?
Yes, hot flashes are basically vascular changes which take place in the body, and
she says how much time they will last post menopause.
They last for quite some time. I mean,
and what should we do to get a relief?
Yes, it is. They last for about till the third phase of menopause is attained, stage of menopause is attained. They last for good 5 to 7 years. So there are different things which can be done. You can take phytoestrogens, you can exercise, you can do deep breathing and meditation. As I said, this is a very strong Indian answer to the management of menopause, and it has shown good results. There is nutrition, the vitamins which are available which would help, but this doesn't help in all cases. Some patients may have actually to take estrogen replacement, and some patients may be managed by giving very small doses of antidepressants as well. Clonidine is one of the medical solutions to that, but that should be taken under medical supervision always.
I think this answers Ms. Komal Chadda's question. Another question is from Dr. Prachi. What is the basic management for menorrhagia?
Menorrhagia, I mean, it is very important to assess how much of blood loss is there. The patient should always get the hemoglobin done. One of the important causes for menorrhagia, hormonal causes, is thyroid disorders, and we should always rule out the thyroid disorders before other investigations. And the NSAIDs, the medicines which are just hemostatic agents, we can use them. So these are the basic managements, but then there may be advanced managements as to menorrhagia. If it is anovulatory menorrhagia, we may require hormones properly for a longer period of time. But then if menorrhagia is because of some surgical disorder, like if there is a fibroid or there is a adenomyosis, then they are to be surgically treated. Unfortunately, depends upon the age of the patient. If it is a puberty menorrhagia, it is to be addressed differently. Reproductive age is to when children are desired, it is addressed differently. When family is complete, it is treated differently. And once there's an old age, and if menorrhagia, reasons for menorrhagia is some kind of a pathology, then surgeries may be required.
It all depends upon the reproductive age
Yes.
group, and the
reason,
sign and symptoms also.
Yes, a reason for menorrhagia. But if you are having menorrhagia because of simple reasons like anovulatory disorders, and you want to preserve your uterus, then probably hormonal disorders, taking good amount of iron, taking good amount of diet which contains iron, and these things are important.
Thank you, sir. मुझे पता ही नहीं चला, टाइम पता नहीं कितना हो गया, and I still want to ask so many questions, but I think we can't go on and on. And I thank you, sir.
Sabita. Thank you, Dr. Sabita. It was wonderful. Your questions are very, very well. I think your questions, they covered almost all
Yes,
the aspects of a woman life. And then thankful to Dr. Nikita also.
Yes, sir. Sir, it's all because I have been your student. I have worked with you, and I have the teaching, your teaching also, sir. That's there. And sir, मुझे भी आज बहुत कुछ पता चला. मैं डॉक्टर तो हूँ सर, बट काफी चीजें in the as a perspective of a common female, you come to know. You don't tend to ask also, you tend to forget also. So काफी कुछ पता चला, and I hope the females and even the males come to know about this because they can help the females. Sir, एक चीज बस लास्ट में पूछना चाहती हूँ सर, बड़ी इंपॉर्टेंट है. Menopause में फैमिली का क्या रोल होता है?
First thing I would say is menopause means I should not pause. And
family का क्या supportive role होता है?
I'm coming to that. Family is very important part to play, because there are a lot many things which are happening around the menopause. And my own example, my mother suffered from a very, very severe menopause, and then she had, I was young that time, did not understand much, but she had actually fractures because of osteomalacia, fractures of the ribs. And we used to tell her that she used to say, I get lots of crackling and pain. And we used to tell, maybe because of your obesity. But then, I found that she had such a severe osteomalacia, and I realized, and we went, and then she became all right. And but we took it as on a war footing. Me and my wife, we took it as a war footing, and immediately went and got her treated. But our objective has to be that the woman has not to reach that stage. We have to understand that the woman will be psychologically disturbed. We understand that she would not be able to sleep the whole night. And we also understand that she requires a care as far as diet is concerned. And whole family has to change their routines so that they are not too demanding on her for a long time. And her physical resources and mental resources, we should know, even the husband and the children, they should know that her resources are draining out. Although we should be replenishing the resources, but at the same time withdraw a bit and try to be more exertive ourselves, so that she is more comfortable in the
So इसका मतलब इस फेज में हस्बैंड को और बच्चों को, बीवी को रेस्ट देना है, मम्मा को, है ना सर, थोड़ा सा आराम देना है. They will look after her. The other way around.
But you can't give too much of rest to them.
No, sir, I'm not saying that part of rest.
No, I'm telling
Luxury.
you, because children love their mother's food, and husbands also love the chapatis made by you. So you can't totally exclude them.
No, I'm not saying. I'm saying just supportive. Okay, sir.
Very supportive.
Yeah, very.
Thank you, sir. They should be given time to be outgoing,
yes.
Interact with their friends of their childhood. Yes, I think they feel very happy once they are, and they should be able to meet their relatives and yes, outdoor activities.
Yes,
They should-
scenarios are changing, sir.
They
I think
plan-
families are going like this only nowadays.
Yeah, there are lady groups which, you know,
Yeah.
are conducting programs outside state, and they are going to go out for days together, and you know, those things can be done.
Yes, sir. Perspectives are changing of husbands and kids nowadays. They are supporting this.
Yeah,
But
they
still.
are.
Okay, sir.
And
Thank you.
even husbands are supporting. I'm happy
Yes,
that previously when you used to ask a husband about the LMP of a wife, and he used to say, I don't know, ask her. Now, you know, you ask LMP to a lady and she looks toward the husband, and the husband has got a record, he's got a
Yes,
diary
sir.
in his
Yes,
hand,
sir.
and he says that, okay, this is the LMP, these are the
That's
problems.
good, sir.
I think involvement is already
Yes,
increased.
sir. Yes, sir. Definitely, I agree. Nikita, ma'am, should we close now or leave?
Yeah, yes, ma'am.
Ah.
It was wonderful session.
Yeah, thank you so much. Thank you, sir, once again, and thank you, Nikita, ma'am. I also enjoyed being a journalist today, and I think ये मुझे ज़्यादा मजा आ रहा है being a doctor than a journalist, sir.
Dr. Sabita, Dr. Nikita, I'm thankful to you for considering me worth it. Thank you so much.
Sir, thank you so much. You had a problem in the family, but still you managed this. So, sir, thank you so much. And once again, I congratulate all the females on this Women's International Day. And thank you once again, Nikita ma'am. And thank you once again, Anil sir. And thank you all the audience which joined and who will be viewing this also. Thank you once again to everyone. Thank you. Thank you.
Thank you.
Thank you. Thank you.